Okay, so I have finished the cardiovascular assessment. So we're gonna move on down to the peripheral um assessment, and we're gonna start by just assessing your abdomen. And you always first start with assessing before anything else. And I'm looking for the aortic pulsation. Most of the time, you can see the aortic pulsation, but if you have like muscular or centered like adipose, then it makes kind of difficult. But then we can just test the feel it with palpation. But first, I'm gonna go on and auscultate the abdomen right above the biblicus. We use the bell and the diaphragm, but the bell is normally better for vascular sounds. So go right above your upper licus, and then it splits so the iliac. I'm doing this here on both sides. And then just gonna go over to the renal. And then down to the femoral and the inguinal canal. Okay, good. All right, and then again, we have a lot of pulses, a good bit of pulses that are palpable. So from that part, we're gonna move up into the upper extremities. And what I'm doing first, I'm assessing, and we're doing both sides. I'm assessing, and I'm just looking, and what I'm assessing for an upper extremity is just like for discolorization or anything, the color. And now I'm gonna just touch and feel for the warmth. And then when I get down to the hand, I'm gonna check the capillary refill, and just to make sure that the capillaries are, working properly. And how you check the capillary refill is you just put down at the fingertip base, and it's gonna blanch, and when you let go in a few seconds, it should come back to normal, less than 3 seconds. And I'm doing all 5 of the digits. Okay, and we'll do the same here, looking for discolorization. It's the warmth. Okay, and then I'm gonna also check your capillary fill. Okay, and then I'm gonna check your radial pulse, even on the side with the thumb. Okay, and then I'm gonna go up to your brachioradialis. Okay, and again, I'm gonna check it on this hand as well. Can't get to the other side. Kind of big. Okay, I feel it. The brachioradialis. Okay, good. All right. Then I'm gonna move down to the lower extremities, and with that, I'm just gonna raise this man's legs up a little bit. Okay. If this was in an actual clinical setting with my patient, I would actually take off the pants and everything and check with, to actually see all my arteries and everything. Okay, so I'm looking for your legs, and again, I'm assessing with the color and everything, and then I'm touching it for the warmth as well with both. Then I'm going to check your dorsopedialis latus. That's anterior foot. Okay, and then I'm gonna go into the posterior media. All right. Okay, and I'm gonna check your popliteal. Just put it up a little bit. Check your popliteal pulse, and with the popliteal pulse, I'm gonna use on both hands, and then I'm going deep enough so that I can feel the popliteal fossil. And normally, how she tells us to do it is you put the 2 fingers together, and then you ease it like a 1/2 inch at a time, and then deep, and then feel the pulsation. Okay, good. And then I'm gonna do it again on this one here. Okay, just a little bit. Okay, great. Okay, and then the last sign we're gonna do is the Homan sign, and with the Homan sign is you're gonna dorsiflex, and at the same time you're dorsiflexing, don't bend your leg, baby, just keep it straight. I'm a dorsiflex, and when I'm dorsiflexing, I'm gonna catch your calf, and if you have any pain or discomfort, that's normally it's like a positive Homan sign, and then you just they do more diagnosis just to see if you have an actual DVT. And again, I'm going to dorsiflex, and I'm going to your calf. Okay. Any pain?
No.
Okay. Was it any pain on this side as well?
No.
Okay. All right. And again, like I said, if it would have any that's the positive homicide, then that can just lead to other tests and all. We look to try to rule out a DVT, but most of the time for hormones positive, normally you'll have like a DVD. Okay. Thank you, Ms. Brown. And I'll give these findings. I'm fixing to step out and document. And I'm going to wash my hands for 20 seconds. And then I'll get with Dr. Jones with my assessment, okay? Thank you.
You're welcome.